There's been about 89 rural hospitals that have closed since 2010, and they continue to trend upwards. So this is not a problem that's going away anytime soon, and we wanted to draw your attention to it today. Most of those hospitals are in the South, and North Carolina is number 6 in the nation for rural hospital closures. The only ones that are ahead of us are Texas, obviously Texas being a much larger state, Tennessee and Georgia, Alabama, Mississippi, and then North Carolina. So it is a crisis in North Carolina, and one that we need to focus on. About a third of the hospitals that closed between 2013 and 2017 were 45 to 50 minutes away from the nearest healthcare facility. What I want to talk to you about today is a message of hope. Washington County Hospital, now renamed to Washington Regional Medical Center, was closed in February of this year and reopened in May. My company started here, Affinity Health Partners, on May 15th of this year. And the first thing that we noticed as we came in to take over the hospital is the staff behind us. And it's a similar story that you will hear in any rural or critical access hospital closure. They took money out of their pockets to keep the hospital open. They made sure that patient care continued irrespective of shortages in supplies, no sheets, horrible situation, horrible environment, and they continue to deliver good quality health care. Aside from the best staff in the state who had to work with very little, my company is making a lot of changes for the facility itself. Many of you who have driven by here over the past several months may have noticed the grass is no longer knee-high. There are actually flowers out there in the flower beds. And the new signage and the new paint that is now on the hospital itself, and these continue inside the hospital as well. And we've obviously renamed the hospital with a new mission and vision, and I think that's probably one of the key things that we've done here for the hospital, is to provide all of the staff as well as the community with a mission and vision that makes sense, not only for rural healthcare but for healthcare in general. We're reaching out to our partners at Martin General, our partners at Vidant, because we don't want to be competitors. We want to work as a health system with them, and part of that is helping them to understand that the hospital has changed. We're upping our standards, and we now have a mission and vision for the facility that all of the staff behind me wearing their t-shirts have gotten behind, and it's a very simple one. It's thought, word, and deed. If we think positively about the care that we're giving, about the community that we serve, that we provide good outreach, then so our words will follow. Anytime you want to come down and have some of our food in our cafeteria, have a cup of coffee with us, or just visit with a provider, do that, because healthcare is not just about when you get sick. Sometimes it's when you just need to have a conversation. You need to understand the trauma that these folks went through without paychecks, without their benefits, without having health insurance, not knowing where their 401k money is. And we're trying to straighten all that out now, but they stayed here through all of that. So I'm very pleased and very proud to have a relationship with them. So we thank y'all for coming. We've got some refreshments over here. If you want to ask questions of any of the staff, feel free. Then if you want to talk to me, I'm around. I love to talk. I'll talk plenty with you. So we really appreciate your time today, and thanks for coming out.